Hi, everyone. My name is Sean. I've been looking at some of the things from the chat. I'm interested in that garden show, whatever that show was, whoever put that. I'm like, oh, I love gardening. I've never watched any of those other, like 90 Day Fiance, Survivor, American Idol. I've never watched any of those. I wonder what that says about me. So, hello, welcome. And oh, what's the question? The question was, I think Ellison put in the chat, what was the last TV show you watched? So my name is Sean. My last name is Taft. I am a macro level social worker, criminal minds, yes. Macro level social worker. I'm kind of getting old now, so I can say I'm at the tail end of my career. But when I was 40, I went back to grad school and got a master's in social work. I also have a master's in business. And I've always been a generalist. So whatever gig I had, whatever job I worked at, I always was somebody who wanted to know a lot about whatever was going on. So I did not need to know the ins and outs of every single solitary resource. But what I do like to know is who's the point person? How do I get in contact with someone who actually knows what they're talking about? And how can I create opportunities for momentum and hopefully solutions? So one of the things that I've always done with every job I've worked at is had a big group of folks that you continue to stay in touch with, and you find out that, oh, they really know this domain, or they're very comfortable with this resource, and you keep growing your network. And I've worked with foster youth, I've worked with homeless and runaway youth, I've worked in a call center for emergency services. I'm currently working for the National Kidney Foundation of Michigan. So I do have a background and experience in trying to connect to providers and to resources. So today we're going to talk a little bit about what I've kind of learned over the last 20 years and tools that you might want to replicate or find helpful in the work that you do. And again, I'm happy if you want to raise your hand or unmute or whatever during the presentation. I won't get thrown off by that, so feel free. And we can go on to the next slide. So I put this up first. This is something I've been working on since 2020. I've developed these systems navigation manuals, and they're called Finding Your Way. We started our first book for Wayne County in 2020. We ended up getting a little leftover funding from the United Way, and we were able to create this first book. And since then, I have created a book for Oakland County, Macomb County. I have a state federal guide. I've worked with a small organization in Grand Haven called Gracious Grounds, and we created a book specifically for folks that have developmental delays and those that lived in their supported housing. I'm working on some smaller books as well. But the idea of these books is just to have all the information you need in one place, rather than having this across like 100 websites that you got to check this, check this, check this. So I start with this just so you can kind of have an idea of what's culminated after my 20 years of doing this work, going, okay, we need this to be easier. And you will be getting a copy of the presentation. There's link to click on the guide to go right. They're housed at the National Kidney Foundation of Michigan, or you can go to the guides. The PDFs are free and searchable and easy to use. And hard copies come and go. It all depends if we have funding to print them. If you have funding and you want some, I can make that happen too. Okay, next slide. Some of you might be familiar with this term, safety net, and I always just like to give a brief description of what that is. And when you think about our safety net, the idea that folks are supposed to be able to enter a helping organization and then get the support that they need. And many of us know that because of limited funding or programs come and go, services are no longer available. that it can be very, very complicated to get folks their basic needs. So when you think of Maslow's hierarchy of needs, this bottom level where we all need to have food and health insurance, and we need access to housing and transportation. Those are the things that are supposedly comprising our safety net. And I mean, we could probably just have a whole discussion about the challenges in the safety net, but for this presentation, we're just going to talk a little bit about the fact that that is what a safety net is. Next slide. So here's some of the realities. Typically, things are underfunded or there's no funding for that resource at all. I always like to give this example. So we have, and we're talking about homelessness, and we're with the group that supports resources around ending homelessness. But so we get someone a house or an apartment and they have no furniture, or they have no forks or knives, or they don't have money to get appliances. So we think as a system, well, check mark, we got them housed. So that I always think about these things that are not funded that are actually essential. Could you imagine living where you live and not having a spoon or a pot or a pan or a couch to sit on or a bed or a mattress? So that's the not funded piece of systems and resources. Some of our delivery systems are still very antiquated, and you can access many of them and you're thinking, why do I got to fill this out? Why is it on paper and pencil? Why do they have a fax machine? And again, a lot of the systems that we encounter are big and bureaucratic, and they may not have the technology available or the funding available. So that is the reality of the system. This whole no wrong door or no closed door, we still really haven't figured out how to talk to each other within our major systems for a variety of reasons. So if you're someone who's trying to access these things, you might have to fill out an application 10, 20, 30, 40 times and keep saying the same things in order to satisfy the requirements of that system. And then we also know, and many of you might know this, depending on where you work, there's probably not enough people there to do this on the ground stuff. It's challenging work. A lot of times we'll see that funders don't really want to fund those kind of general positions. They really want something very specific with a specific criteria. A lot of places are run by volunteers, which is fantastic, but then their exposure to information and professional development might be more limited. People might not be trained properly. Things come and go, people come and go. So that is also a very, very detrimental part to developing a relationship with somebody and trying to get some things accomplished. And then when we look at even what goes on politically, that's a whole nother discussion. But depending on who's in office and who's in charge and what view they have, things that were in place now could totally be overhauled and taken away and not available anymore. So that's always in flux. We're really impacted by anything that's going on a federal, state, or county political environment. Okay, next. Some more reality, and again, just to put them out, I really like to talk about finding resources, because I've had plenty of jobs where on top of the job that I had to do, they would say, oh, and by the way, find these folks some resources, not really understanding the complexity of doing that and how you might spend a day or an hour or weeks trying to figure something out. Or here's a flyer, just like push it across the table and say, oh, here you go, here's some resources. So this idea, unless we can really hire case managers who are trained in this, or if we can hire now more and more, we're seeing community health workers who have that kind of training. None of us really get that kind of specific training on how do I navigate and mine for resources. So it's very time consuming. the folks that we serve, a lot of times they don't have the success in connecting to the resources for a variety of reasons. I like this example of when I used to work at a call center, and I'd get 100, up to 100 phone calls a day. And so you're going down your list and you're trying to call folks in order, and then you call them and they don't answer because they don't recognize your phone, or maybe they just don't want to take a phone call because of a situation that they're in, whatever that may be. So you leave a message and they call right back, but you've already moved on to the next person. And then it's this whole back and forth and the anger of, well, I called you back 4 times, and not understanding how like my end had to roll. So that, even that, like for me, I would love if I get a text, then I can decide, oh yeah, I know who you are and I want to respond. That again would cost some money for an organization to have that kind of capability, but there are things that we could do to make the back and forth simpler. Some of the information that we get, and I don't know how many of you have run into this, where you call someplace and they're not open anymore, or we don't do that program anymore, and they haven't updated their website in 2 years, or it never existed, or you don't know the exact language. So you might call saying you're asking for, just say you're asking for Section 8, and maybe there's someone new who only knows it as a housing choice voucher. We use so much language. And I think a lot of times we'll see that folks, because they don't have the real training and support and background, they're really working from a script. So if it doesn't fit in that script, they get a little flustered, or they might just say, well, we don't do that here. Instead of figuring out how do we have this deeper conversation to then understand what is it this person really needs. And I am seeing some, would somebody read some of these chats? I like this, Anna. You're absolutely right. I mean, the thing is, folks are, a lot of times when they're calling you, they're in survival mode. They might have waited, and it's just because they live in survival mode every day. They're calling me on Friday night on a holiday to say, my lights are going to be cut off today. And I'm like, well, crap, your lights are going to be cut off today, because there's this whole process where I got to put you in the queue, and then we got to have a meeting, and then you got to bring all your documents. And so I know it gets frustrating. Part of what I like to do with the folks I serve is to help them also understand that there are processes around everything we do, and that we have to honor them. It would be fabulous if you simply could just pull up to an organization and get your check for your DTE, and then, be on your merry way. But it is interesting that I think we as providers have to have a further understanding around that too. Like, I don't live that way, so I don't have to worry about, oh my gosh, next Friday I'm not going to be able to pay my electric bill. But some folks, they literally are just dealing with things every single day in the moment, and it can be very challenging. So I try to be very open to understanding people's situation, but I also am always someone who's very realistic. I've worked at places where they haven't wanted you to say we're out of funds for something, because they thought, well, that will look bad on the organization. Well, my thought was always like, well, no, it's bad if we keep having people refer to us and we've got to tell all of them we don't have any money. So there's also that dynamic that exists with even wherever you're working on how they want things to look. And I'm someone who prefers to just be, let's just be real about what's the reality is. We don't need to blame things. We just need to understand this is the situation we're in, and these are the things that we can do. Okay, next slide.
And then we have comments from Anna saying that she'd love to help do the same thing for Kent County of compiling the resources.
Ooh,
And then
yes.
KJ says that their county has a great nonprofit to furnish homes called House N2 Home, and then provided a link also.
Oh, fantastic. See, this is the cool stuff that, like, even if we don't have it down here, say I'm in Wayne County, we do have the furniture bank for Southeast Michigan. But this idea of, if somebody else is doing something really cool, are they willing to mentor or coach or support us to get it somewhere else? Or can we grow it and replicate it and scale it up. So I love getting this kind of information. I am someone who just tucks it all away in my little resource on my email folder, and I'll go, oh yeah, remember we talked about this. As far as doing this kind of thing in other counties, yes, I keep getting funding. I think the next county I'm just finished a book for Washtenaw County that should be ready to go to print probably by late summer. And then I'm going to be working on a book in Muskegon. So that's going to be cool. And then we're talking about doing in the Thumb area, we're talking about doing an electronic version that is comprehensive for the Thumb area. And so, yes, and the other thing is, even if you don't want me involved, I am happy to say, hey, here's our file, here's our model, go for it, do your thing. So for me, this project, and especially the Finding Your Way project, was a way for me to go, okay, here's what I've gathered, and I want to share it with whoever wants it, who thinks it will be beneficial. And Eric, I did see a comment about lived experience. Let me open up the chat. Oh, go ahead,
Yes.
Eric.
So Anna says, having now being someone with lived experience, I have very much come to the point where I have seen it from both sides.
Hmm.
I'd rather be told up front than waste my own time and have to have repeated myself. And also, we have a lot of resources here, but they're so dispersed and unknown that it has been a nightmare, and wish I would have had something compiled before they got to the position they were in. Before that, we had a comment. We were looking to transition from, Jeff says we were looking to transition from needing resources to being a resource to the community and the participants. Jeff says, we provide mentoring for fathers looking to be better involved with their children, families, and community, provided their website. So then Anna just wants you to keep in touch with her for later.
Yes, I'll hit my email is at the end, both ways you can get a hold of me. I love keeping in touch with people. Every time I do something like this, or I'm in a meeting and I connect with someone who's like, oh yeah, they're a mover and a shaker and they're an ambassador. I want to get to know them, because it doesn't matter where we're located. To have that kind of community surrounding me has helped me be effective at what I do. And I am seeing some names. I see Katrina, I know Jeff. Hello, nice to see some friends. So that being said, we can move on to the next slide. So I don't know what happened to my number one, understanding basic need providers. But again, this is, and I love the comment about understanding things from both sides of it. Because yes, even me as a provider, I would love if you came in and I could address all your needs in a very efficient, quick way. I want to support you that way. So the challenge is when I'm a provider and I'm sitting in that seat and I'm like, oh my gosh, I can't help them, or we're out of money, or that program doesn't exist. I feel this sense of I've let you down. And part of what I've always tried to do, like even with my team, is guess what? We're not going to be able to solve all the problems, but what we can do is be respectful. We can be honest. We can be responsive to them in a way that is supportive and help them understand the environments that we work in. So there's always a process, just like anything else. And it was very interesting back when we had, what was that, like 2005, 2006, 2007, that whole mortgage thing went on. And they had this terminology they used called the new poor. So it was folks that had never had to access systems before that all of a sudden needed resources. And they called them the new poor because they didn't have the background that the folks that have been living in poverty had, as far as they knew how to advocate and navigate. Some of these folks so savvy because they've had to do it for so long. And these folks that were new to systems would call and they would be mad as heck because they go, well, I've always paid my taxes, or I paid into this and I don't get that. And why are you waiting so long? And we have to spend a lot of time educating folks on this is a process. This is how many callers are ahead of you. Here's the forms you got to fill out. Why do you need this personal information? Because this is how we've got to get things done. Okay, I'm going to cough. Too much talking. So it is, again, interesting how the dynamic, this resource navigation work and application process and assisted case management, it's very challenging. Excuse me. Eligibility criteria, that's a whole nother thing. So say we get utility dollars from the Michigan, we get it, Michigan Public Service Commission, and they go to the big providers. And when I think of like the big players, I always think of Thaw, Salvation Army, Wayne Metro, St. Vincent de Paul. So they get some, here's your basic eligibility requirements that the Michigan Public Service Commission says you must follow, which comes from the federal government because of whatever line item it came under or whatever project it was part of. There's all of this attached to it. So it just keeps coming down. But somebody might say, well, our organization's only going to help people with utilities every other year. And they're allowed to do that. They're allowed to add in additional criteria. So it can be very overwhelming and confusing. And even for folks that work in the field to understand who does what, which is why when you put out a request, it's very important to add some information like, okay, so you don't put identifying information, but I'm working with someone who lives in X city and they are behind on their bill and they need assistance and be more clear, because so much of what we do is tied to either your income, how many people are in your household, and what city you're in. So there's fundamental things that folks need to know in order to get you pointed in the right direction to support whoever is contacting you. So what I've seen, I'm looking at number 3 going, So we have always in this field, we seem to do a lot with new fancy bright language. And we've been talking for several years about the social determinants of health, which I still talk about it as basic needs, but the social determinants of health are what are the things that are impacting someone's health aside from the apparent health. Excuse me, I'm gonna mute for a second. I'm telling you, my allergies are just whack-a-doodle-doo. So social determinants of health, even the state has a huge initiative. They're making some great strides in moving forward in trying to figure out how can our policies and our processes and our funding accommodate more of these basic needs or social determinants of health. But like many things, you get a whole lot of people involved. There's a whole lot of discussions, a whole lot of meetings, and then you see if something's going to take hold. So nothing on a systems wide basis happens quickly. It takes sometimes years to have that kind of implementation. So if you're on the front lines and you know something's not working, it may take a long time for us to make things. Yeah, I know. The air quality. I went and closed all my windows and put on the air conditioner finally because I'm like, what is happening? So that being said, I am a proponent of policy change, and I know that we on the front lines can support that. But unless we talk to one another and say, hey, do you notice on this application? Here's a great example. So on the My Bridges application, they used to ask for, well, they still do, but you could only use one cell phone number. So say you're a family and you're all sharing a cell phone, but you're allowed to apply for your own application. The only person who got their cell phone number in there first could apply. If the application would not let you move on because you're using a duplicate cell phone number. So many of us, the Michigan Department of Health and Human Services had some listening sessions and they were taking feedback. So that actually got changed. That's like a huge win because that is something now that is not required. Now you may think, oh, well, big deal, but it is a big deal because creating change within systems takes a lot and you've got to talk to the right people and you've got to get this buy-in. But again, if we're on the front lines or the folks we're serving, we have the most experience around what is going on, and we should be invited to the table and have a voice. So I always encourage you, don't ever hesitate to say, you know what, I'm going to reach out. Who's in charge of this? I'm going to reach out to them and see if they even know that this is a problem, because they might not. And a story I like to tell is our application assistance for Michigan Department of Health and Human Services was, I think, one of the longest in the country. It was 30 plus pages. And there were questions. One of the questions, no joke, was, where was your child conceived? That was on this 37-page application, was one of the questions. So they finally started working with, the state started working with an organization in Detroit who streamlined the application down to, I think it's 7 pages. They hope to get it down to 3, and created some change. The folks that were in charge had never even filled out this application. So they had no idea that this information was being asked. So again, I am a huge proponent of the people on the front lines and those that we serve, that they know what's going on and what's a challenge and what's working and what's not. And it's just our job to kind of push that information up. This entitlement concept, that is, again, a whole nother political thing. And we're very aware that depending on your political views, you might feel differently about how much help somebody should get, or if they should get help at all. And I don't know if that's ever going to be anything that we escape. You know, for me, what I think about is, if we lived in a society that actually provided equitable opportunities for people, where they could have safe housing and quality education and reliable transportation, then a lot of these entitlements that we have to continue to support may not be as necessary. But because we don't live in that kind of society, this is the way that things are going to look. There are going to be people that are going to need more support, and that is what the safety net is about. And then you know, Katrina can back me up on this, but I spent some time doing utilities assistance, and even with the money we got, we still could only service 50% of the people that were eligible. And a lot of times that money keeps getting cut, again, because of number 4. So you never know from year to year how much money we're going to get for the things that are needed. And it's still not enough money to service all the people that need that support. Okay. So here, if I was had the magic wand and could be in charge of the world, here's some of the things that we would want in a high performing safety net. We want to focus on outcomes, not outputs, not like, oh, okay, we talked to this many people, not numbers, but outcomes. We want to be able to, within our organizations, share information readily. Now, if you're, say, in a health system, there's protected information under HIPAA. Maybe you don't want your data out there. There is always, oh yes, Anna, loving it. Yes, we understand that we operate in bureaucracy, but that does not mean we need to operate like we're bureaucratic. I really like a more grassroots, nimble organization that can come to the table and say, you know what, let's give that a try, without having to get 400 layers of management to buy in. Adopt innovative ideas and approaches. Like when COVID came and the pandemic came, and we talked about, oh, everyone's on Zoom, how innovative. I'm like, well, that's not, it's really just the internet and a computer, and that's not innovative. So I often think that because we are so really confined by what we are allowed to do with a pot of money, that we aren't allowed to be innovative unless we're applying for some monies where they're actually asking for that and they will fund it. But a lot of times we don't have any room for innovative ideas and approaches, because our money is coming from a place that does not allow that to happen. which is a detriment. And again, that we could have a whole discussion about funders and foundations and things like that, because it bureaucratic systems and people that are in them. I think people have good intentions, but I think if you don't have that kind of experience or exposure, or you've never had to deal with something like that in your life, it's very hard to understand what it looks like. Efficient service delivery, again, that kind of ties into even shared information. There's so many platforms that have come up now, like Riverstar has a platform that they used in Jackson County. They're doing a small pilot project in Detroit. We've got Find Help. We've got even like the 211, which is more of a referral versus a like totally encapsulated system where with providers, we could log in, we could send and share referrals, we could follow up, we could check things as closed so that we knew that it was handled. We're getting there, but because there are so many different platforms now, you might be working at one hospital and you're on Find Help. You might be working at this other community action agency and they're using the Riverstar platform, and then these platforms don't talk to each other and blah. So again, great ideas. Again, not that my opinion matters, but here's my thought on it. Unless a funder, say the state, says anyone who receives money from us has to be a part of this online referral closed loop system, it's not going to happen. And we're going to give you money to actually do it. We're going to give you money so that you can have staff who actually work within the system to make sure that everything's getting responded to. So the ideas are there, but it always comes down to, again, is it going to be enforced? Where's the money going to come from? Who's the gatekeeper on all of this? So hopefully this stuff will continue to get worked out as we continue to work on these macro issues. Customer-centric navigation, again, this is not about a number for me. I can write in my narrative on a report of how many outputs I had. This is about a person who comes to me with a unique situation, who may not have contact with anybody else in any other system. So even if I don't have anything to do with housing, they know me from the food pantry and they trust me and we've developed a relationship. So it's on me now to be a good steward of that trust. And I'm pretty tough as far as that. If you're going to be in this work and if you're going to be connecting with people, that doesn't mean you have all the answers and you can solve all their problems. But what it does mean is you're going to walk side by side with this person and you're going to give them your best and you're going to direct them as efficiently as you can. And it's because if this one person can get these things solved, maybe now they will move out of needing all this support from the safety net. And then it's the next person and the next person, and the next person. So that's literally how I kind of stay sane with the work I've done over these past couple decades. Is I go, okay, the person in front of me, what experience can I have with them? What knowledge do I have to share? How can I support them in a way that makes sense for them? And then move on to the next, and to the next, because this is overwhelming. So I've got to break it down in pieces so that I can stay doing the work and not get burned out. Collaborative partnerships, just like here, folks, if you're seeing some names or you're seeing some comments, you're like, I want to know who that person is. I want to get to know them better. The only way I have been effective in this work is all of my collaborative partnerships. I am so grateful for just the coolest people that I know that also have this passion and this heart and this commitment for wanting to do this work. And it's got to be reciprocal. You can't have partnerships where you're always going to them saying, hey, we're offering this program, will you recruit for us? Well, what are we doing for this organization as well? So I'm very thoughtful about how do we have the win-win-wins and what does that look like? And we're all serving the same people, just at different times or over a different component. So we are holistically a big team. So if you're a colleague and you reach out to me, I want to be responsive and I want to be clear and I want to give you the information I know, or I want to connect you to who does. So that is, I think if you're going to be doing like resources, you really got to have that kind of mindset. It's how I thrive in what I do. I could not be a specialist. I could not be in the weeds with all the details. That is not anything I'm interested in. I'd probably fall asleep. So I'm where I am. And when you figure out what your gift is, and when you figure out what your passion is, and you're in that lane, things just flow. That's where magic happens. So that's my little TED talk on like being your true self. And then the single stop idea, again, this idea of instead of someone having to make appointments to go to 6 different agencies at 6 different times, and they already don't have access to transportation or childcare, or they can't get off work and nothing's open during the workday, how do we think about making this easier? And I know we know with technology, if I can go on Amazon in the middle of the night and order something from somewhere across the bay or across the sea, or that we can do this. It's just in our sector, we have limited capacity to be creative and create these ideas because it always comes down to money. Who's going to pay for it? Where's the money going to come from? And is our funder going to approve it? And again, I love working in the nonprofit sector. I can't imagine working anywhere else, but I also am very cognizant of what the barriers are to doing this work. Okay, next slide. Exactly, Anna. It's what it just, you never know. A lot of times when you, it's like if you know you've connected with someone who's like, oh my gosh, they're a really good worker. I love that. I want to keep their name. And then you find out they left. You're like, oh, who am I going to call now? It's really a crapshoot. You don't know who you've got on the other way on the phone. Did we skip a slide the other way? Just double checking. I think it was the navigation mindset slide.
I thought I fixed it, but let me check. Well, now I
Oh.
just did it again. So
Well, there it is. Oh, well, what are you trying to do to it, Allison?
I think I skipped a lot of slides actually.
Oh,
I don't know what I did, but here we go. We're back on
okay.
track, folks.
So the Finding Your Way books was something after like dealing with all this lunacy in the work that we do. I thought to myself, why is it that every time I go to a meeting, instead of being able to concentrate on really high level things about processes or procedures or advocating, we're always talking about, well, I have someone, and it's important stuff, but I have someone who needs help with housing, or can you get direct me to this food bank, or I don't understand this SCR application. But it's because we didn't have this information in one place. And again, I am not a scientist of any kind. I am somebody who like looks at processes and procedures and goes, could this be easier for me? How do I make this easier? So this is where I just decided I'm going to take all of this information that's available on our public website. So none of this content, except from a little bit of it, is anything that's original. I copied and pasted it from website, but I put it all in one book. So this is, if you're sitting at the desk at a food pantry or at a church or at a school office and someone comes in with the variety of needs, you flip to that chapter and all of a sudden you're a generalist. All of a sudden you've got access to the website, the process, where the money comes from, how do I apply, what's the eligibility, and you're getting someone pointed in the right direction in a quick manner. So you can literally address a whole bunch of needs in one city. Next slide. So I wrote this book for anybody and everybody. I try to talk in regular language. If I had to use acronyms, I would explain what that acronym was. I wanted to make sure that even if you were somebody, and here's a great story. I think it's a great story. I was delivering books for Macomb County and I stopped at the Salvation Army in Mount Clemens, and there were a couple of folks that were waiting for some help. And I was telling them about the books and they're both like, oh, can I have one? And I'm like, well, sure. And the one gal was so excited. She goes, I'm going to go back to my apartment complex because I have a friend that needs this and I have a friend that needs that. I'm like, yes. we all want to know that we can be helpful to someone else. And so this book can, anyone who's in the helping system, but really we have a lot of them of the books that are with some of our legislative offices because they get calls from constituents. A lot of our hospital social workers are very busy and they're very insulated as far as the healthcare system. So they might not have a lot of information. So this helps anybody who wants to use this book. And again, it's very easy read. It's makes you a generalist across a bunch of different basic needs and gets you pointing your folks in the right direction with vetted information. Okay. Next. So here's just a little picture of the inside of the book. These books are big. They're like 180 pages and they're beautiful and colorful and fancy. Now, if you wanted to just print it off the website, you could do that as well. We have the PDF versions, but most of the chapters are set up like this. And I always want to make sure that, you know, the eligibility, because we don't want to send the people we're serving to a resource that we already know that they're not available to get. Or maybe we didn't know that, but that's why I think it's important. If this resource says that you have to be a mother with children under 5, then I write it in there. Because what's frustrating enough is having a need, but then being sent somewhere to call and you're not even eligible right off the bat. So that is always important. The how do I apply for help? Because sometimes even I can't tell you how many hours I spent. I'm like, why can I not find the phone number for this place? And I became very savvy at how to figure that out. And I find with phone numbers, especially, that we really don't have the staff to answer a lot of phone calls. Or with technology, we think everybody can go online and just fill out a form, or they want to chat on their phone. So it's very, very challenging to find phone numbers sometimes and to get anybody to answer it, because press 1 for this, press 3 for that, and then press 5. It's so if you're not someone who's really savvy with technology, you're going to need some help. And even if you're someone who is savvy with resources, you still need some help. The helpful hints advocacy piece is something too, like you may not know in the education domain, if you're not getting what you need, there are some advocacy groups that can help you. Or that the attorney general is there as the lawyer for the state, but does things for citizens as well. So I just wanted to make sure people also knew that if they weren't getting the support they needed from that domain, that there is somebody that can be an oversight or an overseer. And that's the whole point of them. I explain what an ombudsman is, things like that. So it's just important that if you're hitting the brick wall, what do I do now? So I always like to include, if there's advocacy groups, that in there as well. And then where does the money come from? Everything we do in this sector is about money and where it comes from and where the money came from originally. So when you think about your bridge card and why you can't buy non-food items like soap and deodorant and toilet paper, because God forbid we don't need those things, it's because it was written originally in the Farm Bill, and the Farm Bill does not allow that, because we're talking about food and agriculture. Instead of the system going, hey, you know what, this has been a detriment from the time that it's been in place, we just keep operating that way, which is why we need hygiene pantries, because we don't have, our safety net has a big gaping hole when it comes to those things because of the way the money is formatted in our federal budget. Okay, next. This book again is really beautiful. We've got tabs so you can hit the information. You can, like, the transportation tab, the utilities tab, the adult education tab. Oh, you know what? I should have updated that. We do have it in Spanish for Wayne County. We are working on a Spanish version for Oakland County and a Arabic version for Macomb, based on like population and demographics. That's why we picked those. Translations happen when we get more money or if somebody's willing to pay for them. We have QR codes in the books, so you can scan your QR code. If you're in the PDF version, you can click on the URL, so it will take you right to that application. So if you need to go to the application for state emergency relief, click, you can go right there. You can sit down and fill it out, or if you're serving someone, you guys can work together. So I tried to make that as easy as possible. And because bureaucratic systems don't change that often, a lot of this information is going to stay the same. Now, additional resources might come and go, but I can update the PDF version myself as soon as I hear it. Like if you hear of an agency that's changed their name, things like that, if you email me, I can go in and update it. It won't be in the hard copy. But again, what's great about this book is even if, and I do write that in the book, if the phone number is not good anymore, whatever, just go search it and here's the words you use. So I do say that because we know that as soon as we put together a resource book, it's out of date. That's just how resources, but this is about the system. This is not a resource book. This is a systems navigation book with resources. So it is going to stay pretty much the same. Like if you think about early Head Start or Head Start, I mean, that was in the 60s, the war against poverty, community action. Well, we really haven't changed much since then as far as the system goes and the processes. So that's why this book is going to be pretty valuable and it won't be out of date. Okay, next. This navigation mindset, I kind of alluded it to a little bit earlier, but if you're going to mine for resources and if you're gonna like deal with systems, you really have to have this navigation. Yeah, I do got age wage. I updated all of that, so I'm good to go on that. Thank you, Teresa. Yes, those are the kind of things that you're like, oh my gosh, everybody changed their name. Well, my first version of the Wayne County book, the next year, the state changed like most of the URLs and their phone numbers. So I'm like, oh my goodness, I had to update all of that. But again, that being said, you still have the language and the understanding that you might not have had before that will get you pointed in the right direction. But this navigation mindset, again, these are just some simple things that I have kind of cultivated over the years of doing this work. I had no experience doing this when I came in, but because of the way my brain works, this is just kind of how I started having this navigation mindset. But joining groups, I'm telling you, I'm on these listservs for Washtenaw County, Wayne County. I run one called Wayne County Resource Champions. I'm one on Macomb. I'm one that's kind of like my Commonwealth website. I'm on a bunch of different listservs. And I don't care if I get 100 emails, because if it doesn't apply to me, it takes me 1 second to hit delete. But when I need connections to a mass group of people that are in a certain area, I have it. So using my networks, joining groups. And if you're not familiar with warm transfer, that just means that if I needed assistance with somebody, instead of you just saying, call so-and-so, you would make the phone call for me, or we would be on the phone together, because maybe Katrina doesn't know the person I sent, but she knows me. Oh yeah, Sean, I can help you with this. Connected with trusted source of information. We will find a lot of information out there that is valid, and then we'll find some that you're going, where did this come from? Where's the original source? So I always think it's very important. Like if I see something on Facebook, hey, they're giving away, free laptops at this church. I was like, okay, who created this? Where did it come from? How do I verify it? Because I don't want to, if I can avoid it, share information that is not vetted and not logical and not somebody that we can trust. And then this federal, state, or county resources available. Again, a lot of times people say, how do you know this stuff? I'm like, I didn't know, but I just Googled it and I said, hey, is there a support group for autism? I'm not really in that realm. And then you'll find a lot of times there might be a federal organization and then they have their own state entities. So I search stuff all the time and then can just start kind of mining down till I get what I need. Next. So here's some of the countywide networking groups. Wayne County Resource Champions is a group I started in 2015. We've got almost 1,000 members now, and I just do it for free on the side. It's everybody who's in the group has ownership. It's our group to kind of just get stuff solved. So if you have a question or need a resource or want to share information, you send one email and it goes to these 1,000 folks. Macomb Resources has, they have a listserv as well. There's the Commonwealth, which is a clearinghouse for flyers and events, which is woefully underused in the Tri-County area. Macomb is who started it, and they use it a lot. What I really want to do is get more counties. We do have maybe 6 or 7 counties that can use it. I know Wayne and Oakland County are barely using it, and this is it's an amazing tool. You literally can go onto the site and you can search if you want to search free events, or if you want to search for food, if you want to search for support groups. And then whoever had actually uploaded their flyer in there, it comes up. You can click on the flyer, you can print it. You can click on that website and go to the agency and find out more. So I'm not sure why it's not as used in the other counties, but I'm hoping that you might take a look at it and see if it would be useful, because it's just, you can never have enough tools to help us do this work. Barrier Busters is a group in Washtenaw County, which I also am a member of. And again, they typically have meetings every month or every other month, and they share a lot of information. So I understand what's going on in the county. We're out of funding for this, or we're opening this up. So those kind of groups are valuable. And again, you may think, oh, it's a lot of emails, but a lot of them, especially the Google groups, you can say, I only want to receive a summary email once a day with 20 emails on it. You can set it up so that the frequency is meeting your needs. Okay, next. Helpful tips. Again, there's never enough tools. I wish there was a tool that made us doing our job simplified, and those that we're serving getting what they need in an efficient manner, but there isn't. So there's never enough tools, and there's no one answer that's going to solve the challenges that we have in navigating resources. So just, be kind to yourself and understand there's just lots of different ways to get at what I need. Relationships are key. I'm telling you, relationships. I know specialists in almost every domain that have helped me grow my understanding, but guide me and direct me. I'm a generalist. I'm not really a specialist in most things. I guess you could say I'm a specialist in being a generalist. So I'm going to coin that for me. Community ambassadors. So if I go to a meeting and I see somebody who's like, wow, they know their stuff, I will approach them. I will say, can I have your email? Can we connect? Can you help me with this? And what you will find is most of us that are in this helping field want to be helpful. And I look at you as a colleague. So I want to support you in any way that I can with what I've learned. And get and give, this being reciprocal. Again, it can't just be where I say, hey, I need to use your site so that I can recruit for my programs. If you come to me and say, hey, do you have space that we can use to, yes. So making sure that a lot of times when we go to community meetings, what we do is just talk about, oh, our agency is doing this right now, and here's the flyers. And I always like to ask the question, how could I help you? Like, what do you need? So even if I can't do it, if the question is out there, then people are like, oh, I am familiar with that. But it's interesting how we don't do that a lot. We don't say, what do you need right now as a provider? How can I help you? Okay, next. So free copies, the PDF versions, they're available on our website. You can go on there anytime. And even if you want, it's searchable. So if you're on there and you're looking and you want to just type in food or utilities or housing choice voucher or Section 8, it will take you to the chapter so you can find that. Right. Oh, here's Allison wants people to do a survey.
Yep, I thought I had a QR code for it, but I don't. I'm hoping it comes up at the end of the meeting. There should be a link that pops up on your screen when you log out. If it does, please fill it out. If not, sorry, Zoom has changed things. But we do have some questions, Sean.
All right, humans.
Go, Eric.
So Anna asked, how does someone come about creating a job/career out of doing this work, as it would decrease the overall expenses in all systems through through this kind of work.
Well, I will say, Anna, if you're one cool thing that has just happened is now we're going to be able to bill for community health workers. I know there's some rigmarole as far as like rules and regulation because it's either through Medicare or Medicaid. I don't know. Whoever created the code that we can bill to. That being said, what we're going to see even on a state level is what's happening with social determinants of health. And hopefully we can get some things going before we have a new administration that might not support it. We're seeing at a lot of places that they do have folks that work to do resource connecting. And as an RN, you might want to see even within your hospital system, if you're thinking of expanding your role or changing your roles, but it is very valuable to have these tools. What I will say is almost every job that I had, I would do whatever it said on paper. And then I did this added magical stuff that then the organization would go, wow, this is really needed. Can you continue doing that? So it's, especially as a macro social worker, you don't go out there and see a lot of jobs for macro social workers. You literally see jobs for folks that want to do clinical stuff, but you do have the ability to create this lane for yourself based on your area of interest. And when you do that, you see your passion for that come through, and other people see that as well. And I'm always happy to talk to anybody about anything. I mean, I've been on the planet a lot longer than a lot of you, and I have learned some things, and I'm happy to share the things that I've done in this field. I've come from a marketing background, and I have a master's in business. So I kind of approach things in a hybrid way, which in what I found in the nonprofit field, people aren't as, I don't want to say aggressive, but kind of as aggressive as I would be as far as this is what I see, this is how we're going to do it, this is where we can get the money. So I look at the business of working with people is still a business.
Okay, and then Carolina asks, is the PDF updated frequently? The PDF of that you shared.
It is. I just updated. I try to update it at least every year. We had to do a whole bunch of things from changing from one graphic designer to another, but now that everything is in-house and cleaned up, it's going to be a lot smoother. So if somebody emailed me something and said, Sean, hey, you got to change this, I could go right into the PDF and do it right away. So I'm always keeping my eyes and ears open, but I also always appreciate if somebody's in the manual and they go, this is wrong or this needs to be changed, you just let me know and I can go change it. Okay, next slide.
There was one more question that someone wanted to know. What was the best way to use LinkedIn or other resources? What LinkedIn or other websites looking for resources? I lost it, but that was the gist of it.
Oh, interesting. I rarely think about using LinkedIn for resources. There's a lot of people I work with that don't even have LinkedIn accounts. So I guess you could put it out there in your network, but what I find for me, LinkedIn is more of a place, for your professional profile, for if you've published something, like when I published the Finding Your Way books, I put it out there. If you're supporting an organization and you're going to an event. So curious, I've never thought of using it. I will say that creating these resource groups with people on it who really are there for that particular purpose is extremely valuable. And it's not hard and it's free. And if somebody wanted to create one in their groups, I could help you or give you the instructions, or you could look it up. Because what I find is there weren't a lot of generalist resource groups. There's a lot of groups if you're in substance abuse or domestic violence or disabilities, there would be groups very specific to that, but there wasn't a anything goes group. So that's what Wayne County Resource Champions is an anything goes group. And what you'll see here is, so I work for the National Kidney Foundation of Michigan. That's my email there, especially if you have any questions about our programs or services. We work with littles all the way up to seniors around any like healthy lifestyle changes and preventing diabetes, supporting those that have diabetes. And we have a lot of physical activity programs. We do a lot of support group work. So if you're not familiar with what we do, you should check out our website. And then if you want to get a hold of me at Wayne County Resource Champions, that's kind of my generalist email where people I know from all walks of life, that's where you can connect with me. I don't think there's any more slides.
That's it.
That's it.
Okay.
Oh my gosh, did I get it under the hour? Whoa, 2 minutes late, but
Yep. Perfect. Okay. So I am going to thank Sean so much for providing her expertise and wisdom, and I'm going to stop the recording. I appreciate all of you coming today. I know that taking any amount of time out of your day when you're busy serving folks is a lot. So I appreciate that you coming today to learn how you can do that better. If the survey pops up, please take it. It really helps us provide you information that is helpful to you. We have a free webinar once a month at MICA. We also do paid training. Again, I want to thank Sean for providing all this information for us. And with that, you are dismissed. Thank you so much.
thank you, everyone.